Probably not using these right, and I'm a cosmetic dentist. I see a lot of mistakes being made. Here is the first tip. This box came with 32 strips, but you can actually double them by cutting them this way, hot dog style, and then only placing the strip over the front of the teeth and not on the backs. The whitening solution does disperse in the tooth even if there's no direct contact on the back. The second thing that so many patients do wrong is they will put these right over dental restorations, like if you have a crown or a veneer. So let's say your two front teeth are crowns. You actually need to cut the strip and place them on the sides like this, so there's no direct contact. The reason for that is that Crest Whitestrips are slightly acidic, so if you put direct contact onto a crown, the glaze on the crown can disintegrate over a period of time, and it may not look as nice in a couple of years. Tip number 3 is the hack of all hacks. All you're gonna do is buy a cheek retractor that keeps all the lifts out of the way, and then use your Crest Whitestrips. The reason this works so much better is that it's going to minimize the amount of saliva that gets in contact with these strips, because the saliva actually deactivates the active ingredient in the strips. And by getting these retractors, you are mimicking what we would do in an in-office professional whitening scenario, except that these are much lower concentration than in office, but it will make these much more potent.